The content of this podcast has not been evaluated by Health Canada or the FDA. It is educational in nature and should not be taken as medical advice. Always consult a qualified medical professional to see if a diet, lifestyle change, or supplement is right for you. Any supplements mentioned are not intended to diagnose, treat, cure, or prevent any disease. Please note that the opinions of the guest or host are their own and may not reflect those of Advanced Orthomolecular Research Incorporated. Hello and welcome to Supplementing Health, a podcast presented by Advanced Orthomolecular Research. I'm your host, Dr. Paul Hrkal. This show is all about applying evidence-based and effective dietary, lifestyle, and natural health product strategies for your optimal health. We are going to feature some very engaging clinicians and experts from the world of functional and naturopathic medicine to help achieve our mission to empower people to lead their best lives naturally. This episode of Supplementing Health is brought to you by AOR's quercetin. Quercetin belongs to a family of antioxidant molecules called flavonoids that are commonly found in apples, onions, and other citrus fruits. Research shows it is effective for reducing allergic symptoms like those with seasonal allergies, diabetic complications, and cardiovascular concerns, all thanks to its potent anti-inflammatory effect. AOR's quercetin contains pure, high-dose quercetin that is citrus-free for those with sensitivities. Look for it today at your local retailer or at aor.ca or aor.us. Welcome back to Supplementing Health. As always, I'm your host, Dr. Paul Hrkal, and we have a super engaging and interesting show. I'm excited, probably one of the most excited for this particular guest, Dr. Marie Matheson. She's a naturopathic doctor with a focus in chronic infections, complex autoimmune illness. And today we're going to be focusing on something that, especially this time of year, in the spring, as we get into the warmer weather in the summer, it's tick season. And so people are now seeing more incidents of tick bites and obviously all the issues around the chronic infections and the Lyme disease that comes out of that. So I'd like to welcome Dr. Matheson. Thank you so much for joining us.
Oh, thanks so much for having me, Paul.
So Dr. Matheson and I kind of go back a little bit. We've worked together. I've referred a couple of patients back and forth. She does practice in Ottawa, in Ontario, Canada. And she's also been part of the AOR Medical Advisory Board in the past, which has been just an absolute treat to work with her on different projects. And as I mentioned, she uses a whole host of naturopathic modalities. And really, I think what I've learned from Dr. Matheson is just understanding that the body has this ability, this resilience to fight infections and to heal itself. And oftentimes those things actually get encumbered. And so she uses a lot of therapies that are focused on terrain. And we might even get into that just to explain that. But she does have a lot of experience in treating chronic infections. And she's actually completed an ILADS physician training program with Dr. Charles Ray Jones, who's a medical doctor in Connecticut, one of the top pediatric Lyme practitioners in all of the US. So she has a lot of experience. So Dr. Marie, how did you even get into chronic infections? Because this is, as a clinician, this is something that a lot of other clinicians don't really want to touch with a 10-foot pole because, it is super complex.
Yeah, well, as all doctors who kind of work in this realm, it came from a personal story with my own niece who was infected by a tick bite, and I didn't know how to help her. Certainly the doctors in my city didn't know how to help her. And so through following a Lyme literate medical doctor, and then engaging in courses myself, she overcame, thankfully, and still is great to this day. So that was my journey, and then it followed by my own children's tick bites. And then what happened for me was that Lyme, you see, was a light bulb moment for everything. Actually, Lyme was a gift. Lyme was where I started to realize. I started treating these patients for these Lyme infections, and all of a sudden their MS symptoms got better. or their vibrations or shaking got better, and their numbness and tingling got better. And I started to realize, wait a second, the Raynaud's would go away. So, are these infections related, in fact, to other ailments or medical labels, if you will, that are in fact due to chronic infections? And so that was a major light bulb moment in realizing, we have a big sign in our office. When you walk in the cloakroom, it says, "We treat the cause, not the medical label." It's very known as naturopathic doctors, we treat the cause, not the symptoms. But really, I took it a step forward, is like all these patients are labeled with ALS, Parkinson's disease, MS, rheumatoid arthritis, etc. But really, the underlying cause is a chronic infection, not just Lyme. It can be mold illness, a viral infection, a parasitic infection. Yeast even can create a really chronic illness type symptoms. And, I think back to my time, thanks for mentioning Charles Ray Jones. He's kind of my hero. And, my training was actually done with a pediatric population. Mm-hmm. And, Charles Ray Jones' story is quite an incredible one. And I'm not sure if I ever got to share this with you, Paul, but
go ahead. No, I don't think you have.
Oh, I have. Yeah. So, he was treating so many kids. He moved from New York City to Connecticut as a pediatric doctor. And by the dozens in Connecticut, these kids would come in with a diagnosis of juvenile rheumatoid arthritis. And he was like, what is going on in this town? Like, all these kids have this arthritic type symptom. And so one day, one of the little kids had a really bad pneumonia, and she needed 3 weeks of antibiotics, a pretty heavy dose. And she came back and she said, "Charles Ray Jones, my lungs are better, but look at my knees, they're all better." And he went, "Oh boy, maybe there is a relationship between infections and this arthritic type symptoms." So prophylactically, empirically started treating these children with antibiotics, and they got better. So, the case in point, rheumatoid arthritis, juvenile rheumatoid arthritis, is AKA due to chronic infections, or, Lyme disease in this case.
Yeah, I mean, that's such an incredibly powerful story. And I remember you have shared with that with me in the past. And, that every doctor usually has some sort of aha moment with their treatment. I mean, I've had many of them, but this is obviously a huge one for you. And, it's funny, when I graduated almost a decade ago now, I was reading literature, from doctors like Dr. David Perlmutter, who's kind of an Alzheimer's disease expert. And he was saying, something like a Parkinson's or a degenerative condition, one of the main underlying issues is a potential like herpes infection or chlamydia infection. And there are, when you start diving into the research, kind of what Dr. Jones kind of, I guess, figured out just in his clinic, is that there is connections to chronic infections, to especially autoimmune like conditions, and the immune system starts attacking the wrong thing. So, I mean, I'm sure that was just such a powerful, and then from there, like from what you've told me, you've just like kind of never looked back. Now that's been like your focus and practice, and people come from all over the world to come be treated by you, right?
Well, that's right. Exactly. So that was my aha moment, my light bulb moment, whatever you want to call it. But it was like, wait a second. All these illnesses we were told in school that we would just palliate, that we would just kind of cushion and just kind of help along with symptom picture, and that's about it, is like, it opened the world for me. I was like, okay, who can I help now? Okay, right. Doors are open. Let's go. Bring it on. I am no longer scared. I'm no longer going to go home and frantically as a young naturopathic doctor and kind of research an illness for 10 hours and hopefully try to help this person by 5%. I'm going to actually try to get these people out of their wheelchairs.
Yeah. And I think that's something I've learned from you just working together, is that it's easy to, like you said, look up in a textbook being like, hey, you know what, for rheumatoid arthritis, Boswellia at 300 milligrams 3 times a day is what's indicated, where, I think you've always talked about, well, you know what, that may help their symptoms 20%, but it's not really addressing the root cause. And it still is, even though it's natural, it still is not going after the reason why their immune system's actually attacking their joints.
Very, very well said, Paul. Exactly. Yeah. That's exactly right. And there's nothing wrong. I love Boswellia. It's one of my favorite. It's like I use it all the time I use Boswellia all the time, but I don't use it alone. I use it along with whatever the underlying infection may present, a parasite. So then I'll use an anti-infective herb along with it, and I'll get, it's sort of like a double whammy. I'll just get so much more profound changes with patients, and long-term changes, right? Not just here, take Boswellia for the rest of your life.
Exactly. Yeah.
Just to get our patients off. I always tell my patients, right? The idea is to keep you out of my office, right? Is to help you get better, and for you to tell 10 patients that I got you better. I don't want to keep you here forever. I want to teach you how to get yourself better. And sure, in a pinch, use Boswellia for a massive headache or, crazy joint pains, just a flare up that you're having, but, and use, long-term for during treatment, but you shouldn't have to use it for the rest of your life on a daily basis.
Yeah, and that's so liberating for you to say that, because I think a lot of people just replace their drugs with natural herbs and remedies, in which, yes, it is definitely a step in the right direction, no doubt, because of the side effect profile of a lot of these drugs, especially the ones that are used for a lot of these autoimmune chronic infections, that they have a really nasty side effect profile. But as you just said, it's still something they're probably going to have to take long term if they don't do all the other things. And you know what? I do want to get into that at some point. But before we get into that, I kind of want to take the listener through a bit of a stepwise process. And so, as I mentioned at the beginning of the show, there is now warmer weather. Ticks are more active, potential for getting bitten. So let's kind of take us through that whole idea of like, okay, so you know what should people be watching out for? How should they be preventing themselves now going into the warmer months? Because you just told me before the show, there are people getting bitten now more and more. I just saw one of my neighbors, there was a tick on his bicep. He was just working outside. And I don't think he was deep in the forest. So, what are some things that people need to be aware of in terms of avoiding getting bitten?
Yeah, so I first want to start with that. I really truly profoundly believe that we should not live in fear. With COVID right now, I think we're all living in fear, to some sort of low drone level. I see that with my patients. They're not stressed, but they are stressed. They make instances where I can see the stress response because of COVID. So, the idea is not to box ourselves in and stay inside and never, ever go outside. But, the idea is to be always hyper aware, for example. So here's a perfect example before I go into summer prevention type symptoms is like, walk on the trail instead of bushwhack. You see a bush, don't let the shrub and the long leaves sort of rub you on, rub your arm, just be mindful of that. I kind of laugh sometimes when I'm walking on the trail with my kids and they're like little ninjas, right? They're like dodging the grass leaf that, that's in the way in the trail, and they just do it subconsciously, right? I don't even need to tell them anymore. They just don't want to be touched. They don't want to tick bite. Yep. And so that's the idea, is to not live in fear, but if you have to cut logs, wear a long sleeve shirt, wear long pants with socks over top. My daughter last night went to do social distancing at a campfire with a friend, bike down there. And I said, you're going by the river, you know how to dress? She goes, yes, Mom. And she came out, she had her she's 14. She had her leggings on with her socks over top. She somehow made it all look cool. But anyway, the point is she was very well covered. She even tied up her hair, right? You don't want to have long hair sticking out through your hat where they can attach to. They can fall off trees, right? So my kids... Some kids lately just got bitten, just because they were walking under trees, they fell off the trees, in endemic areas we're talking about. What I'm seeing a lot is that parents are so happy their kids are outside. So people are going to cottages if they have the ability to. Some people are still going to their cottages in Ontario anyway. And what happens is the parents are working inside the cottage and they're just telling their kids to just go out and forage and whatever. And so these kids are coming back with tick bites because they're not really being supervised, because parents have to work full time. And so they're out in the bush in the forest with their friends, and parents think, oh, this is so great. But, even with, a lot of these kids have been bitten behind the ear, inside the ear. The ticks have been found 4 or 5 days later. because they're just hiding in all these little sort of crevices. So, I really urge people when they're coming from the inside to kind of strip down, and really look under your armpits, the groin, lower back, crevices, behind the ears, as I said, in the hair. These children, funny enough, a lot of the kids that were bitten didn't wear hats. So the kids that had baseball hats on did a lot better. So, they may fall in through the hair and then find a warm spot and bite that way. So really trying to cover up as much as possible, trying to avoid jumping into, leaf piles, as well as, walking through a bushy area, taking the long way home as opposed to, walking through like Little Red Riding Hood and getting in danger. So, those are some of the initial things. Of course, wearing a bug spray. We use natural bug spray. I have my recipe on my website if users are interested, viewers are interested. Mm-hmm. It's essentially, essential oils that I combine along with sesame oil, which has an affinity to prevent fleas from adhering. And so, natural, or, if you want to use other products, that's fine too. But those essential oils seem to ward off those ticks. They just don't like the smell.
Right. Yeah. So, those are a lot of amazing practical tips. And so I think you just like practicing like tick hygiene, like as you mentioned, and just being mindful that it can happen anywhere. It can happen in a park. It doesn't always have to happen in, a wooded, bushy area. And that's the thing that, a lot of people are noticing. Yes, you do increase your risk if you go in through long grass, but you could get it, playing in your backyard, because it can be transported on birds, which, like waterfowl are a huge source of that. So I think we need to consider all those things. Is there anything that, is there plants that people can plant in their backyard? Like I've heard, and where there's this an old wives' tale or not, like mint or cedar mulch. Is there anything to that type of stuff?
Yeah, absolutely. I think it would help. I think if you're in an endemic area, it makes it harder, tougher. There are some of my patients that are doing these tick tubes where they soak, use tongs and soak permethrin, cotton balls, stick them in toilet paper rolls and scatter them throughout their properties. That has been really good to prevent ticks from infiltrating their area. Certainly grooming your property, right? So not letting the grass grow long. If you've got a big property, sort of trimming the bushes around the household, and keeping the property nice and clean. One of the things that some of my patients do then that are endemic areas is they use lint rollers. So you can buy like a big 12-pack at Costco. It seems to be better than just brushing off with the broom, because you can actually stick the nymphs, which are literally take a pen, make a dot on a page, and that's how small these nymphs are. So you can't really visibly see them from the eye sometimes. In some cases, you can, but they're very small. And so these lint rollers, they'll just sort of roll it on their jackets, et cetera, before they walk into the house. And that's really another kind of tip that I've learned from some of my patients. But certainly, yes, think about all the essential oils we use in the bug spray. So bergamot, lavender, rosemary, lemongrass, like you said, mint, peppermint. So those would all be beneficial. It's certainly worth a try, and they're certainly delicious anyway to make fresh tea with. So I think that's great.
Yeah. Awesome. And I think that obviously the next logical question is, all right, what happens if you do get bitten? And I had an experience that you kind of helped me navigate. It was probably now 3 years ago. My middle son, Nicholas, was just, again, we were in Toronto. We were close to one of the high park, the biggest park there, but it wasn't in the bush. And again, we had a very small backyard, and we just noticed that evening he just had a bullseye rash on him. And it was on kind of his arm, and we didn't notice that there was any sort of tick. And my understanding is that if you see that bullseye rash, and it can come in, not like a typical looking bullseye, but it could also be not exactly the same. And so there's various presentations of it. That is kind of what we call pathognomonic, meaning like you've been bitten by a tick, and there's Borrelia there, which is the Borrelia burgdorferi, which is the bacteria. So what's the first step people should be thinking? Because that at this point, that's when panic mode sets in for parents, when they either find a tick, it's there. Walk us through those kind of acute steps.
Yeah. So, and it's really great that you mentioned that pathognomonic. In medical terms, that means that symptom or the presentation of the symptom is enough of a diagnosis without any serological evidence to diagnose Lyme disease, right? So that is, right there. Okay, so you got a bullseye rash. The way I explain it to my patients is that you wouldn't get a rash if the immune system wasn't activated. So why is the immune system activated and creating a rash? It's warding the infection away from the rest of the body. And the body's so smart, right? So it's creating a ring of attack. So there's something that's happened. If there's a rash, there is an infection. So we need to address that. So first and foremost, if you have seen the tick, if you do pull the tick off and you do have the tick, I would put it in the freezer right away. And then I would go on a website called genetix.ca. This is an Ontario company, and I really like them because for $150, you can test for Lyme disease and co-infections. So you can expedite the shipment. So for $25 extra, you can get the results within 2 days. Now that's quite amazing because that kind of helps just decipher, how long should we do treatment for, if we should even do treatment, if the patient doesn't even have a rash or symptoms and the tick comes back negative, then that can have an impact on your decision making. Of course, I treated a family who they've all had, within their family of 6, Lyme disease 5 times. So for the mother, even with a negative tick, that came back, we still decided to follow through with treatment. So, it all depends on the patient and the doctor's comfort level. So first, if you do have the tick, send it out and get it tested. Not only for that, but just for methodology and epidemiology and just kind of a better, deeper understanding of the infections in our areas. So I think that's really important that way. A lot of other labs don't test for Lyme, don't test for the co-infections. So this is why I like this lab, is because they will test for the co-infections. And Babesia and Bartonella are extremely endemic in Quebec and Ontario. And those are the ones I worry about in terms of neurological symptoms. So I am always a believer that treatment works best when you have, and I call it a fresh tick bite. So that gives the idea that it's fresh, it's new within the last month, and that's actually when treatments work. Right. So that's when you actually want to treat a person, whether you decide to do pharmaceutical route or natural or a combination of both. But that's when if more of my patients got treated at this stage, I wouldn't, I wouldn't be overworked. I always want to be busy, but I wouldn't be overworked. Right. So yeah. The idea is that, I wouldn't see as many sick patients if they actually got appropriately treated. So, depending on if there's a rash, if the patient's symptomatic, et cetera, that's when we choose, do we go with a pharmaceutical route or do we just do a herbal route or a combination? I typically like to do a combination of both and try to work with the patient's doctor as much as possible. I will say, because my training was done with a pediatric population, and from a personal experience with my own children and my niece, is that children's immune systems are so strong, they don't mount a response right away. So often parents go, they don't have a rash, they seem fine, but then 6 months down the line, my ballet shoes hurt, and it's really weird. He got pushed in basketball and he's got joint pains everywhere. And so, 6 months, 9 months down later, the child actually develops symptoms. And that's quite common with children, to not develop symptoms right away, but to develop them 6 to 9 months later. And poor parents, especially they don't really put two and two together, that, the bullseye rash in September and now we've got symptoms in June. How are those two related? And so they end up, going to physio, going to other chiropractors, and trying to manually fix the joint problem or et cetera, or think that it's low iron because their child is so chronically fatigued. But in fact, it's actually due to that tick bite a long time ago. So that's why I'm a believer, Paul, you should always treat a fresh tick bite, mildly, aggressively, but I do believe it should be treated.
Yeah, and you mentioned right off the top there that there's a lot of co-infection. So, I mean, sometimes, testing will help us identify that. In your experience, based on what your you've seen or your patients have said, how many ticks or tick bites roughly do have some sort of infection? Do they come back positive?
That is a great question, because there's new research that's just come out that I just got to hear Dr. Burrascano speak last month at the TFIM. And so we have new research now, Paul, that's showing that these ticks are born infected, right? So we're finding now, the research is showing that the eggs are infected. So we used to think, okay, so the nymph has to bite a squirrel, a rat, et cetera, in order to be infected. And then that's how the passing occurred. But research is now showing that we're seeing eggs that are infected. So, we don't really stand a chance. So it's more than likely that the tick is infected. And it's always best to be precautious and, cautious on that than to let it go. I always tell my patients, one of the things that helps to sort of narrow in on it is that, I always say to them, when I graduated in 2005, there is no way I ever thought in a million years I'd be advocating taking antibiotics for a fresh tick bite. But, the consequences of having chronic Lyme disease far outweigh the consequences of decreasing the microbiome by a little bit. We can fix that. That's actually how and what naturopathic doctors do best. We're good at that, so I feel pretty confident I can get that microbiome back. Yeah, it might not be, I'm not guaranteeing it's going to be the exact same, but I really have seen very few of my patients have adverse reactions or develop C. diff because of all the great things that we do, Paul, as naturopathic doctors to support the gut and the microbiome. So I'm always a proponent of treating that fresh tick bite fairly aggressively at the 4-week window. And there is a window where you have to treat this. If you miss that window, you end up getting chronic Lyme. A lot of patients come in, see me, they've been sick for a year, 6 months, 3 months, 10 years, 20 years. And all of them will ask me, so do I have chronic Lyme? And my answer is always, well, if you were bitten more than 4 weeks ago, then yes, you have chronic Lyme. So, it really does go very quickly and embed into the tissues and create chronic symptoms fairly quickly. So we do want to get on it as soon as possible. And for the viewers out there, whether you are parents or patients or even naturopathic doctors, seek help right away. Don't try to just treat this by yourself. See a Lyme literate naturopathic doctor or doctor to get the help that you need. There isn't really I've been asked all the time, can you design a protocol? And I've got basic stuff, but it always switches depending on the patient's symptoms and depending on the presentation of the illness.
Yeah, I mean, you've hit on so many points there that I think that they are pain points because, it's someone like ourselves. We've gone through some of the research and we're aware of some of the protocols, but mass majority of people have no idea what to do right off the start. So they like you said, start panicking. So I think that point of getting that help is huge, but there aren't that many Lyme literate practitioners, whether it's definitely, naturopathic doctors, there's a few, and they typically are pretty busy like yourselves. And then there are medical doctors that do have some experience, but I can count them on 1 or 2 hands in the whole province, and they also have massive waiting lists. So I think there needs to be some greater awareness and working with your family doctor. So I can speak from my personal experience where we did go to Sick Kids in Toronto, and they were like, well, you know what, we don't know if it's Lyme. And there still is that, like, in the conventional world, there still is a lot of misinformation out there. But that being said, I think people are now starting to get a little more wiser and being like, no, I still want to take the antibiotics. So because he was young, we didn't want to do doxycycline, which is the typical one that you would use, because it does mess around with tooth formation. So we used another one, I believe zithromycin. And they did prescribe it. And so you have to work with your family doctor. But I think that brings me to my next question, where I'm sure you see this so much, is that people are so frustrated with a lack of help that, the conventional system gives. So yes, you can advocate and get that, get that antibiotic ASAP. And I would suggest, as you mentioned, combining that with some natural things that will help remove some of the toxicity that's going to grow in your body, improve that immune resilience, support the microbiome, all the great things that naturopathic doctors do. And then, then there's frustration that sets in for people after that point, because their doctor may not want to prescribe the antibiotics. And then that's for acute. What about chronic infection? So can you speak just a little bit about why is there so much why is there such a problem with the conventional system just not able to help patients?
Yeah. So my underlying belief is that it's lack of education. I mean, if doctors were more educated, I don't buy into, it's an insurance company fraud. The insurance companies, it's, their hands are tied. That could be secondary, but it's lack of education. So once a doctor becomes sick themselves, their family members become sick, that's when they come on board. But, there's no real motivation to go and do a course on Lyme disease. And, doctors are told to use antibiotics judiciously. And because the research is just so back and forth, and there are, there's this issue of post-chronic Lyme disease as opposed to, Lyme disease. There's really a lot of, controversy, I would say, on the level. And, I guess that my thoughts are, all the doctor friends I have, the MDs, have been sick themselves, or their family members got sick, and that's why they're on board. So it really comes from a personal matter. I'm starting to treat politicians who are sick. And so things in the world only change, as my sister says, things in the world only change when we get sick, or when, we protest or petition, or et cetera. That's when movement happens. And so unfortunately, that might be what it's going to take in order to have the mindset changed. I will tell you, when I first started practice with Lyme disease, I used to think that the antibiotics were the answer, even for chronic Lyme patients, on all cases. But I quickly, started to realize that wasn't really the case, and that in some cases they do require them, and they do better with them. But in most of the cases, our naturopathic medicine and what we do, Paul, is where our treatments shine and where patients get better. In fact, I have patients who cross the border, gone for 2 years, come back 30-40% better, and then we put them on our herbal protocols and vitamins and minerals, and they do profoundly better. We address the teeth, we address their adrenal glands, we address a mold issue. We find out that perhaps they have exposure to radon, and all of these things have an impact on the immune system's ability to fight and heal from these chronic infections. And once you heal those other things, including emotional trauma, which is a big missed important piece of the puzzle, people start to do better, and it's not necessarily the antibiotics that are the answer. And that's why I'm so grateful of being a naturopathic doctor, that we have all these tools that we can use to help our patients overcome this.
Yeah, I think that I agree with you totally that, antibiotics, first and foremost, the takeaway message for the listeners is that if you can be more proactive early on, the better you are in that first, month window. It's also testing is not even accurate until after that. And it's almost like once you get the results, it's almost too late in most cases, right? So, you have to be proactive, and so that's your best shot. And then, I think just to finish the comments you made about the medical profession is that, I genuinely think that, as you said, it's a lack of education, and there also are a lot of issues just from a medical legal perspective where, it's antibiotics should be judiciously prescribed. And if they've been overprescribed, and there's a whole host of negative downstream effects. And now one of the downsides now is that now they're being a little bit more stringent with them. There also needs to be a diagnosis with any sort of prescription. And so a lot of docs don't have the education, family docs especially, to be able to confidently say, yeah, this is for Lyme disease prophylaxis, because Lyme disease kind of by definition is, it's like positive. You need a positive test to go ahead and treat it. And, the testing inaccuracy, especially here in Ontario, and anything that's really publicly funded, is a massive problem. And I don't know if you can speak to that a little bit, because I think that's a huge point of frustration, is that people that have chronic Lyme and even acute Lyme, they're like, I can't get the help that I need because nobody wants to touch me because I haven't had a positive test. And the accuracy of these OHIP funded tests are really, really low.
Yeah, and my argument to that is that, you go to your doctor and get a prescription for Topamax or an anti-migraine medication for your diagnosis of a migraine, but there is no serological test to test you for a migraine. There's no serological test to test you for fibromyalgia or chronic fatigue syndrome, but they will prescribe you Lyrica, an antidepressant for it, which does help with the pain. So, our point as Lyme literate doctors is that we don't need, first and foremost, CDC states that this is an illness based on clinical symptoms first. So does the person meet the criteria for the symptoms of Lyme disease? Fatigue, neck pain, intermittent fevers, perhaps joint pains, etc. Secondly, does the person have exposure to Lyme? Do they hike? Do they camp? Do they see ticks on their pets? Did they see a tick bite on themselves? Did they get a bullseye rash? Were they outdoors when they got sick and immediately got sick within weeks? And then lastly, serological evidence. So that's lastly. So we need that last. And so it is as I said, a real detriment to our society that we're not at least treating patients initially with that fresh tick bite, and now it's almost like, and I'm really going on a limb here, but I'm just going to say it. It's almost like the College of Physicians and Surgeons has basically shut down all patients by keeping their mouth shut, by allowing doctors to now prophylactically give the one dose of doxycycline. I mean, same seeing, nice that you said that about your child. You're not supposed to take doxy under the age of 9 years old, but now we're giving doxy, the one pill, to 3-year-olds, 4-year-olds, 5-year-olds, because that's what the college has said. And so parents are actually being kind of like, oh, good. It's just like false security. It's like wearing gloves for COVID, right? It's like, you're still touching the virus is still touching your face if you're touching your face with a glove. But it's this real false security that we have by just taking that one dose of doxy. And so we're not getting this hysteria in the hospitals or in the doctor's office where parents are screaming at the doctor to give them the antibiotics, but the doctor won't give. It's either I give you 2 weeks or none. Well, now everybody gets it. And so everybody's shut up. And so everybody just stays quiet and goes, well, no, I got my one dose, but I'm just wondering why my son has still really got this knee pain. And, but we did the doxy, doctor, but why is he still sick? So This is a real shame, a real unfortunate. And what the studies, what Joseph Burskano is saying is that one dose actually pushes the infection deeper into the body. So we're actually doing our society such a disservice. And we're just kind of palliating, just kind of like, keep your mouth shut, and now you're okay. You got your one dose, all right? So get out of my office. I don't mean to be so crass and so in your face about it, but emotionally, this is what I see these poor parents deal with on a weekly basis. And it's so frustrating for me because here I am trying to fix the damage now that should have been, if it had been appropriately treated at the time of the fresh tick bite, I wouldn't be having to deal with all this damage control.
Yeah, and I'm glad you brought that up because there's a huge psychosocial, psychological side of this, and I think like with anything, if you approach it with a lot of anxiety and stress, you're going to have less than optimal outcomes. But the fact of the matter is that we need more practitioners that are such as yourselves that are literate in chronic infections. And, there are not that many out there, and we need more of them, both on the naturopathic side and on the medical side for sure. I just wanted to also briefly touch on, just for the people that are listening and they're thinking, okay, so could I now have Lyme? Because, Lyme disease and other chronic infections, you look it up online and there is a laundry list of symptoms. And, I've at any point, a person could look at that list and be like, well, yeah, I have Lyme. I probably can convince myself that's the case. So you need somebody that has that clinical experience, that is going to ask you the right questions. You can't self-diagnose this. And even if you do have a negative test or a positive test, that still is not, and I think what you're saying, enough to accurately kind of dictate what the clinical process should be. So, I think the symptomatology is most important that you mentioned. Just to review that for people, because I think that might have just been missed in what you said. If you have symptoms that are especially joint pain and symptoms that are waxing and waning, meaning changing all the time, they migrate through the body. Typically it's not easy to be, all my MRIs are negative and I'm still getting, this numbness and I'm getting these neurological symptoms. If it doesn't fit the kind of typical diagnosis, then it's most likely a chronic infection. So I'm really glad you brought that up. Okay, so let's say somebody has been bitten potentially in the past, and they have some of these symptoms, and they've moved on to that chronic sphere. What is just without maybe getting into the specifics, and I know it's so personalized, and I think that's the beauty about what you do. But what are some things that people and other even practitioners should be thinking about in terms of from a natural approach? I'm not talking about the antibiotic because that's a whole nother topic. But what are some things that we can kind of support the immune system to kind of combat this infection?
Yeah. So first and foremost, I would say nutrition. So really working on in fact, I look at Dr. Terry Walls, who's got the Walls protocol, she's 95% better with MS. This is a medical doctor who was diagnosed way back when with cervical, progressive MS. So she couldn't even move her neck. And with 8 months, she was riding a bike by getting on a gluten-free, sugar-free, more paleo type diet. And so I use her as an example because oftentimes, there's a wait list to see me, and patients will come out of the appointments and tell their friends who are waiting to see me, listen, she put me on a, sugar-free, gluten-free diet. And those people will say, well, you know what, I'm going to do that right away. And they come into my office a few months later and they're already 30% better. So when people tell me, oh, I really don't really feel like going on the diet, I really don't feel like avoiding sugar or gluten, it really does make a difference, especially with neurological conditions. So diet, first and foremost, as the basics of what we do for naturopathic medicine would be most important. Secondly, I'd say really focusing on detoxification. That's another big one and a misnomer. Some people can have access to buying a sauna, start detoxing their bodies, and all of a sudden the toxins are no longer impeding on the immune system, and the immune system itself can actually take care of the infection. without going as far as, saying the exact herbs, some of the herbs that we use, like cat's claw, astragalus, cryptolepsis, those are all also beneficial. But I would tell the listeners to be cautious, because that can entail a die-off reaction. And if you don't know what to do with that, it can be fairly scary. And it's basically an exacerbation of your current symptoms. And so it can cause a lot of anxiety. It can tailspin my patients. So I would say seek help once you start using the antimicrobial. But anything you can do to change your diet, as well as help with detoxification, getting an ionic foot bath would be good. Dry skin brushing, castor oil packs, some of the age-old naturopathic cure-alls that we've always used in our practices are some of the timeless and really most effective treatments. I mean, I have a patient who can barely eat right now, who's got, gallbladder reflux. And the only thing she's able to tolerate is a teaspoon of castor oil rubbed on her liver. It's the only thing that's helping her. Nothing orally. She can't tolerate foot baths. She can't tolerate anything right now, but that's it. And so sometimes the most basic things are actually the most helpful. But, people aren't willing to do that. It's a lot more work. But I always kind of, one of the things I'm loving about COVID right now is that I have more time for self-care, right? So I rotate between doing my foot baths and my sauna and lymph brushing. I'm doing a little neurofeedback before bed. I use my laser. It's just so fun to be able to take such good care of myself. And I feel great. I'm sleeping well. I feel like I've got a little extra hop in my step. I'm exercising like crazy. I've got rosy cheeks, and I just feel good. And so sometimes just doing those basic things without even looking at the infectious piece yet can have a tremendous impact on a person's health. So
yeah, those are like the foundational things. I'm really glad that you brought that up, because I think especially in the sometimes even in the Lyme literate ILADS world, which is the big conference, the association that kind of is hosted every year. And that's where the docs that are focused on treating chronic infections go. You get focused on what's the new antibiotic or what's that new extract. And, those things are not nearly as effective as if you don't do all the things that you just mentioned. So hydration. What kind of air are you breathing? How are you sleeping? And looking at all the different stress responses around that. Like just as simple as those basic things. Your immune system is very active during the night, and you detoxify a lot during the night. Those are two major things that we want to activate in any sort of chronic infection. And you can apply this to, immune resilience and being antiviral, which I think a lot of people are trying to do right now, or you can apply it to chronic infections. And you're right. People don't want to do the hard work. They're looking for the quick fix, even in the, in the Lyme world. And that's not to be flippant to say that, if you just do these things, you'll get better. Because as you know, there's a lot of people that have a pristine diet and they do everything by the book, so to speak, and they still don't feel great. They still have a lot of symptoms. So that's where, working with someone such as yourself is so valuable.
Exactly.
Go ahead.
Oh, I just wanted to say, being a Lyme literate doctor, you really have to be on your game, because you've got some of my patients are smarter than some of our colleagues, like they've had to advocate for themselves. So, most of my patients nowadays come in, they've already done the diet. They're already doing all the detox things. They've done all that, but they're still sick. And so that's where I'm there to help piece it together and piece the puzzle and help them with that, the last bit. They're already 50% better, but they just want their health back completely, 100% better. So yeah, you're right. It's not to be flippant. It's a beginnings, but those are the initial things that I would say, that you're going to do so much better with, so much faster. I mean, I had a mom yesterday come in, speak to her, and she's already done the GAPS diet with her autistic child, and et cetera. And so she just needs that extra, the antimicrobial piece. And it just makes my job so much easier when I don't have to go through all the basic things. She's already got the foot baths covered and everything. So, I think those are basic foundations. And in fact, I would go as far as saying this, Paul, especially when I speak at conferences and doctors go, I've done all the things you're saying, but my patient's still sick. And I go, yeah, well, have you questioned them about the diet lately? And they go, what do you mean? And I go, well, just find out that they're still, doing the right foundational things, that they're not drinking 3 beers a night. One time I found out, Paul, one of my patients said, is it okay if I take my yeast killer with a glass of white wine? And I thought, oh my God, I did I miss this? Did I miss something basic? She's still complaining of yeast infections all the time. And so I'm like, sometimes it's not our treatments that have failed, Paul, but more so that we haven't reiterated the foundational importance of eating well. And I practice what I preach, and then me, we know each other on a personal level. Right. We happen to be in New York City, and you asked me where we're going, and I took you to this little hipster, organic. It was good. I sought out this organic restaurant that we were able to have, and great food together. And so I do think this is an important piece.
Yeah, for sure. You can't underestimate that. And then that's a big assumption is that, a person's actually sticking to that, because that's quite difficult to do. And then there's a degree of patience that has to take place. You can eat a really good diet, and most people, and I've yet to see a patient saying like, oh, you know what, that did nothing. And if they did, then I'm really skeptical on whether they actually followed it and adhered to it. Or they still, they ended up having half a bar of dark chocolate when, there's other things that are sabotaging it. But that's where I think working with someone that is literate in chronic infections is so important. And that brings me to, a resource that I wanted to share with everybody that's listening. You wrote a chapter in a book called New Paradigms in Lyme Disease Treatment, Top 10 Doctors Reveal Healing Strategies That Work. I read this book. I thought it was very valuable. It's available on Amazon. So, how can people get to know a little bit more about the work that you do and, get in touch with you? What's your website?
So that's that book. I've since moved clinics. We opened a beautiful clinic in Ottawa called BioHeal Ottawa. So www.biohealottawa.com, info@biohealottawa.com. And it's a Wi-Fi free clinic, which I'm really proud of. It's super healthy and clean and mold free. And awesome. We've got a little patio deck. So actually we're going to open that up as our part of our waiting room once COVID lifts and we're able to take patients in house. So people will sit in our little garden patio. And that's how people can get in touch. Certainly our website will have lots of information. We're pretty descriptive about everything on our website, just to have access to have people access more information as possible. I do have a great colleague I work with, Dr. Jessie Pierce, who's taking patients as well, and certainly can refer to Lyme literate doctors across the country if needed, if people are elsewhere.
Awesome. That's so great. I just personally wanted to thank you for the work that you're doing. I know that it's difficult work because there's a lot of people that are very sick and they need a lot of TLC. They need a lot of care to kind of really get better. So I think we need more of that. One final question before we wrap up, if there's a person that's listening that's saying, hey, listen, what are the 3, 4, 5 core things from kind of a nutrient perspective? We talked about diet, but what nutrients should they, have you seen, what these are the foundational things that I need to support my immune system and immune resilience? I have some of my favorites, but I'm interested on what yours are.
So again, they oscillate for me. I'm a big, proponent of doing something for detoxification or drainage. Always, I always feel talking about the terrain, and for the viewers out there, the terrain is, having good soil growing as opposed to bad soil. And that if we actually plant, throw our dinner leftovers, I always tell my patients, throw your dinner leftovers in your garden. you're going to grow maggots, but if you throw organic soil, you might actually grow a nice flower. So, drainage remedies are often great. Basic stuff like vitamin A, ACEs or A, and zinc are some of my favorites. These days, I'm using a lot of quercetin. I find it's antiviral, anti-allergic as well. So it decreases the replication of a virus, as well as a very, very good for mold toxic patients. Boswellia is another great one that I love using. I often use combination herbals that help to support the immune system. And then single ones like astragalus can be very helpful. Bunch of different.
Awesome. Yeah, that's great. Obviously, that changes depending on the way you're feeling. And, I have a protocol that I use, and there's permutations of it, but I think you touched on the main core ones, making sure all your fat solubles, A, D, and then, zinc, I'm a huge fan. The more I just hear about zinc and looked at the research, and I have done a very deep dive during this whole, pandemic period, the more I just fully respect how important that mineral is, and all the other ones that you mentioned. Quercetin's a big fan, especially now it's like allergy season. So why not get the best of both worlds with, some of the antimicrobial, antiviral effects, plus the mast cell stabilization of the quercetin. So that's a great one. But it's in high demand right now. I know that it's been sold out in a lot of places, right? So I'm sure you can get more hands on it. Marie, it's been an absolute pleasure having you join me. I really appreciate you sharing your expertise and basically just your insights, just with your years in practice. So keep up the great work, and I really appreciate you just sharing everything that you have in the last hour or so with us on Supplementing Health.
Oh, well, thanks so much for having me, Paul. It's always a pleasure.
Yes. Thank you, everybody, for listening. I really appreciate you guys joining us today. And if you want to get in touch with Dr. Marie, she mentioned a couple places that she can get in touch with her. So just find her on the web. There's some resources on our website, so check that out too. Thanks for tuning in, and we look forward to having you guys tune in next week. Thank you for listening today. For more information about our guests, past shows, and future topics, please visit aor.ca/podcasts. Do you have a topic that you want us to cover? We invite you to engage with us on social media to request a future topic, or email us at marketing@aor.ca. We hope you tune in again next week to learn more about supplementing your health.